All right, welcome to the Hygiene Elevated podcast. Today we are joined with Beth Patel and Sarah Crow, and we will be discussing Botox in dental hygiene today. But before we do that, I want to give the floor to our guests and allow them to introduce themselves. So, Sarah, if you would just share your background in dental hygiene with us and tell us a little bit about your journey. How'd you get here?
Oh my gosh, thank you. Yeah, my journey of dental hygiene, I want to say, is being divinely guided, probably by my grandmother, which sounds a little bit strange for those of you who don't know me, but uh, I do believe that. And my grandmother was a dental hygienist. She was a dental hygienist. She graduated from the Forsyth School for Dental Hygienists here in Boston, Massachusetts, in 1927. Which was like 100 years ago. But the interesting thing is that I didn't know she was a dental hygienist when I decided to become one myself. She was elderly when I was born, and she had died when I was 12, and we lived in different states during my childhood. Um, so I do still believe that I'm being divinely guided by her in this lovely industry of dental hygiene, which I love. But I would have to say my first inkling of wanting to enter into the field of dental hygiene was probably around the age of 18. And that was when I got my braces off. I would say, like, the three of us, right? We've probably each looked in hundreds of thousands of mouths, I can imagine. And
Yeah.
we've seen some pretty horrible malocclusions, I would imagine, but
Yeah.
I will bet each of you $100 that you have never seen a malocclusion as bad as mine was. It was horrible. It was so horrible. And so, all kidding aside, I was really self-conscious about it. I would never smile without covering my mouth with my hand. I certainly would never throw my head back and laugh, because that bird's eye view of the maxilla was frightening, even for non-dental or even for dental professionals. It was just frightening to see. And so, I was the youngest of four daughters, and, we didn't have any money. I was raised by a single mom. We were on food stamps. And so she just, she didn't have the money to get me braces. And I remember I was 16. I had woken up at my sister's house. I was babysitting the night before, and my brother-in-law had come downstairs for breakfast, and he had had a great night the evening before out with his buddies by the lake, in the fire pit. So he comes downstairs, stumbling down, looked quite hungover and probably dehydrated, wearing the same clothes from the night he had on the night before. And he looked down at in the pockets of his pants, and he had wads of cash falling out of his pants. And he looked really confused because he didn't know why he had money in his pockets. And then it hit him. And he said, "Oh, my guys, I sold my boat last night." And he takes the money and he threw it at me. And he said, "Here, go get yourself some braces." And so he threw me a few $1,000s. And that was a big chunk of my braces. And I will never forget that day. But the day that I got my braces off, wow, what a significant change. I mean, it changed, of course, my smile, but my confidence. And I just wanted to be able to do that for other people, And I just feel so fortunate that I've been able to do that. And yeah, the rest is history.
Sarah, what
Nice.
a cool story. I love that.
It is. I like that.
Yeah. It was definitely a pivotal moment in my life, for sure. I have those pillars of moments in your life. That was definitely one of them. So yeah, no, he's a great guy.
Sounds
To
like
see,
it.
you today with just this beautiful smile, I can't even imagine this mouth you're describing before braces.
Thank you. I think, I need to find a picture. I think I need to find a picture of me with those teeth, because I know most people don't believe me. But of course, I had a lot of teeth extracted, and, it was years of braces. But Yeah, it was one of the biggest changes I've even seen to this day as a dental professional. So yeah, that's my story.
Wow.
Nice. Sarah, how long have you been practicing dental hygiene?
So I've been in
I'm sorry.
dentistry for about 20 years, and I've been dental hygiene for the last 10. So I started off actually as an orthodontic assistant. I always wanted to go into hygiene school, but I had a daughter pretty young. So that kind of took a back burner. So I was a 411 operator during the day, and I was a bartender at night. And there was a gentleman who would frequent the restaurant where I worked, and he'd watch me behind the bar, and I was very meticulous. My bar was very clean. My fruit was always very fresh and organized, and he would watch me, and he said, what did you say you wanted to go to school for? I'm like, oh, I really want to be a dental hygienist someday. And he said, well, listen, he goes, I have a friend who's an orthodontist, and he's looking for an assistant. I think you'd be a good fit. And so next thing you knew, I was interviewing, hired, and was buying my first pair of scrubs at the age of 22. And I worked for him for quite some time. I was there for, I want to say 7 years. I met my husband during that time. I had my young daughter, and I inherited his 5 children. And then we decided to have one more, which makes 7. So yes, I have a blended family of 5 girls and 2 boys. And I remember it was 2008 when the recession hit, and my husband's business took a big hit, and it got pretty rough with 7 kids and being in a recession. So that was it for me. I decided this was the time. This was the time to make my dreams come true. And I decided to go back to dental hygiene school. And I remember applying and going out to the mailbox. When you go out to the mailbox and you get your acceptance letter, and you're so excited. And I remember jumping up and down. Finally, I'm going to go to dental hygiene school. And I called my mom, and she was like, that's wonderful, honey. That's what your grandmother did. And I was like, no, mom. No, mom. This is a dental hygienist. Like, this is different. Like, she probably was like I was certain my mother had no idea what a dental hygienist was. I don't know why I thought that. But she said, no, she did. She, went to Forsyth, and sure enough, I mean, I don't know if you can see behind me. This is my grandmother's class. I know for those who are listening, I don't know if it's video or just audio, but this is my grandmother's class from 1927. And she sits right in the middle, and it's still posted. That photo is still posted in the clinic at Forsyth in Boston. So yeah. The rest is history from there. I love dental hygiene school. I loved it. I was SATA president. I sat in the front of the class. I was that girl. But I just knew that this is something that I always wanted to do. And yeah, I guess it's in my blood.
I love that. I love your story so much, Sarah. Beth, I would love for us to share with all the listeners your hygiene story too. How did you get here?
So I am the oldest of 6 children. And I was born without 20 and 29. So from a young age, my parents knew that I was going to have dental intervention. Once again, those 6 kids, there's not a ton of money. So I did get braces, but then everything kind of stalled. And I remember being so embarrassed about these, as the baby teeth fell out, I just had holes in my mouth. And around that same time, there was asthma. I have really bad asthma, and there was a asthma trial at Berkeley. And so my mom signed me up for it because we obviously didn't have a ton of money for me to do other treatments. Well, that medication got pulled from the market. It destroyed a lot of my permanent teeth in the back. So now I'm a young woman and I'm missing teeth, and my teeth in the back are crumbling. And it was that's just very hard, I think, to go through. And the dentist and the dental hygienist that worked with me to get my mouth back, they were so wonderful. And it took up a lot of time, and they worked with my parents because financially it was hard. And they never made me feel like I wasn't doing a good job or that I wasn't taking care of my teeth. They had so much compassion and empathy for me. And that made me just fall in love with dentistry because I wanted to give someone else that same feeling. And so, being the oldest of 6, there wasn't a ton of money. So I ended up moving to Tennessee. I went to a historically Black college on a minority scholarship, which was the best experience of my life. Like you were talking about pillars in your life, that was one of them. I met people from all over the country. I saw a really different approach to just the world and where people were coming from. Oprah graduated from my college, so there was such a rich culture there. And so when I graduated, I decided to stay in the South because I love the kindness of the people and, and I found a very good job where I stayed for 10 years, loved what I did. And I think at the end of the day, for me, this profession, I get to meet every individual person at their place in life and help them move towards health. And I just don't think a lot of people in general get to say that, that I get to move people towards health without the use of drugs, without surgery per se, or removing things. I am the first line of everything that goes into your body, and I get to help you move towards health. And so it was just, I loved it from the beginning. Like I always wanted to do this. I never really wanted to do anything else. And so I just pursued this career. And so I was at the same place in Tennessee for 10 years, a small private practice where I love to be, just helping individuals. And so I think that that's really the gist of my career, is from a very young age being shown compassion and empathy and wanting to give that forward to other people to restore a smile. Because like Sarah was saying, there is nothing like smiling and having beautiful white teeth or beautiful straight teeth or beautiful healthy teeth. Everybody has their own ideal of what they're looking for. And as hygienists, we're able to get them to that place. So I think that would just be my story.
Oh, Beth, that is beautiful. I can totally see how you guys align, and their stories have so many similar aspects to them. I can totally see how a friendship has flourished from just
Agreed.
hearing your guys' stories. Yes. But I am curious. So Sarah, how did the two of you meet? You guys are such a cute duo.
Oh my gosh. Bethy is my hygiene sister. She fell, it was like the hygiene heavens plucked her out of Tennessee and just dropped her right into Salem, Massachusetts, to work in the operatory next to me. So I'm pretty sure that's how that happened, right, Beth?
It is kind of. Well, so the doctor that I worked for in Nashville, when I told him I was moving to Boston, he said, there's only one place that you can go to. And so he gave me Salem Dental Arts, and I drove out there and I went for the interview, and I drugged my husband along because I was so nervous. And when I left, I was like, what do you think? And he goes, I don't think I've ever seen a more perfect place for you. So
yeah, it was a quick fit. I mean, I was the only dental hygienist in the practice where I work. This was back in, when did you join us, Bethy? 21, 22?
Yes.
Yeah.
21.
So we were growing and we needed more hygienists. And so, yeah, I want to say the doctors were friends. And so, yeah, yes. Bethy was basically plucked out of the heavens and dropped right into Salem Dental Arts. And honestly, I loved Beth right away because I knew she was an elite dental hygienist. She wasn't going to be a hygienist that kind of just sat back and, chat and polish and, talk about vacations and pets more than talk about health. And, I, as a dental hygienist, take my job very seriously. And I just needed to have somebody that I could work alongside that took their job as seriously as I did. And she just fit right in. And it's just been so easy. It's been a match.
And I agree from my side, because, you go through life, and I was subbing at different places, and it's like, when you meet another professional that is like, I'm here to make an impact, you know it and you see it, and your patients feel it. And I think one of the best things about us is, if you see me or you see her, we're looking for the same things. We're going to say the same things. We're going to have the same outlook. And so it gives a lot of continuity with our patients on what we have as a standard of care and moving towards health.
I love that. As I'm listening to you guys, it's almost like you're describing the A team, right? The A team of hygienists who are very serious about preventative care and being preventative specialists. And so for everybody listening who feels like they haven't found their A team yet, they're out there. They exist. There's a whole plethora of hygienists who are going above and beyond during those appointments for patients.
We're part of a movement. I feel like there's a movement. There's a movement in our community, and it's really exciting.
Well, it's beautiful, and it's so inviting. It's not like anybody can join. It is like the more, the merrier. We're here for it. We want you. And it is, you're absolutely right. It is a change. It is new, and it's very inspiring. I'd have to say, I am very inspired by you guys being members of your board for your association out in Massachusetts, that I have volunteered to be one of the delegates for Utah. So we'll see what happens with that.
Congratulations.
Thank you. I am very excited to volunteer and serve. And it's really just being inspired by the other individuals that have done it before me. And so, let's turn a corner here. Sarah, you are the immediate past president of your association. What is the status update for Massachusetts and hygienists administering Botox right now?
So Botox is our newest initiative in Massachusetts. We filed that bill back in January 20th of this past year. And Beth and I had the pleasure of visiting the State House to advocate for our bill. We were able to provide testimony in person to the committee. And it was an incredible experience. The bill, as of right now, the way it was written, and I'm pretty proud of the fact that I did write the bill myself. I did some research because nurses are able to administer Botox here in Massachusetts, and so are dentists. And so I just did some research on the nurses bill and then the dentists. And I just kind of combined that verbiage and, put it together to make it look like something that we wanted as dental hygienists, and gave it to our lobbyists to file. The way it's written right now is under the direct supervision of a dentist. And the reason why we decided to do it that way is because if you think about all the bills that dental hygienists try to move forward, who do you think is the number one oppositional association?
The Dental Association.
Correct. It's the dentist. And it's sad, but it's true. And so for this one, I felt like if we write it under the direct supervision of a dentist and we allow, dental hygienists to get educated and start to administer, it's easier to change verbiage than it is to kind of bring in a brand new bill. So, I figured let's get everybody in, get this passed, everybody, administering without any issues that are reported, and then go for changing some of the verbiage. But there was not a lot of opposition for this bill. Would you agree, Beth? I mean, when we were there,
I agree.
I didn't get to read all of the opposition, but there was just one woman that had had decided to.
I think it was a dermatologist, which was quite shocking to me because I didn't really think that they were paying attention to what we were doing. But that was the only one there.
Yeah. I mean, they pay attention if they feel like it may affect them in their industry in some how or way. I don't know. She really didn't have any good information. I mean, she went before me and she was up there talking about how dental hygienists have no education on head and neck anatomy. And I mean, we kind of giggled, right, Beth? We just kind of laughed.
We both looked at each other. We were like, okay.
Yeah. So it was kind of nice that I got to go after her because I was able to address all of the things that she had said during her testimony and went into detail on, no one has more head and neck anatomy than a dental hygienist.
We should have left her a card so she could come get a cancer screening where we look at the head and neck anatomy.
Yeah. 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 So to answer your question, I mean, the state of the bill right now is in study. So it is being studied right now. So it's fresh and new, and hopefully we'll get passed quickly and easily. But Massachusetts is historically slow with legislation. So we're here, we're advocating. And if you want to be a member of MDHA, that would be a huge help. That's for sure.
Absolutely. Well, I'm glad you guys got the ball rolling on this. This is going to be really exciting to watch this slow progression, right? Let's see, Beth, I wanted to ask, what sparked your interest in wanting to advocate for Botox for the dental hygienists, and what's the experience been like so far?
So I would say it was probably about 2 or 3 years ago. The dentist that I was working for started really looking into Botox for TMD, for issues with that masseter muscle, especially in their patients who are clenching all day. We know that they can't wear a night guard during the day, and trying to find some relief. And I think through that course, I just realized there are so many other applications for this. If we're talking just about Botox, we're looking more at muscle. But when we're talking about the other things like filler, then you're looking at symmetry in the face. If there's deficiencies, being able to address those within the tissue. And I think it just gave me this excitement because anytime I'm learning something new in hygiene, I'm excited. Like any branch of hygiene, I want to know about it. I want to read about it. I want to cuddle up with it at night. Like I want to know everything there is to know. And so Botox is no different. And so I just think I'm excited for the pain relief applications as well as the other applications in symmetry of the face that hygienists are so equipped to do. We look at the face all the time. We measure in millimeters. So we have such an understanding of small changes in the face and how it impacts the overall smile and muscle mass in the face.
Yeah, and you're right, Beth. And I think some of the other benefits of Botox is really to help our patients. I mean, at the end of the day, that's what it's about, right? If we have a tool that we can use in our toolbox to help our patients, why not? Why not? Let us get educated. We're all about education. Let us get educated on it and let us help our patients. I mean, because that is at the end of the day, our goal. And I remember coming back from COVID and the stress level, you could cut the air with a knife, right? Anywhere you went. But I remember my patients coming in and they were so stressed. They were breaking teeth. There were so many broken teeth after COVID. And, I just think that Botox is just another tool that we can have in our toolbox to help our patients,
No, absolutely. When I think back, we are the head and neck anatomy experts. This belongs in our scope. This belongs here. This was it's just time for change. It's time that we can do that. Like, it's mind-boggling that we can't. I'm like, or that it's such a hard battle to even make it happen.
Agreed.
So, Sarah, given that not all the states will very few states actually will let hygienists do Botox right now, what advice would you give to hygienists who may not be members but also want to see Botox happening in the industry?
Oh, that is the easiest question to answer, and that is to become a member.
Yes, I just wanted you to say it. I'm like, just please be members.
Like, I don't. This
Is that a
bothers
leading
me so much.
question?
Yeah, this just bothers me so much. I mean, like if all of your listeners can just pause right now and literally just go to their Safari and type in adha.org/join and literally sign up right now. That is the best thing that you can do. And I don't think that a lot of hygienists really understand why it's so important. And I can tell you, at least in Massachusetts, that, that lobbyist that I was talking about, that I, wrote the bill and gave it to him and he filed it at the State House, he's very expensive, like thousands and thousands of dollars every year that we have to pay him. And in Massachusetts, I can tell you 60% of the membership dues go straight to paying our lobbyists. So if you think about it, in the state of Massachusetts, we have approximately 7,000 registered dental hygienists. MDHA, Massachusetts Dental Hygienists Association, has about 600 members. That's embarrassing. If you think about the number of dentists in the state of Massachusetts, which I don't have that number off the top of my head, but I do believe it's less than the dental hygienists. But you think about the percentage of dentists that are members of their dental association, it's closer to 100%. So you have the dental association with all of these members and all of their membership dues, right, going to pay their lobbyist or lobbyists, because they could probably afford to have more than one firm. And then you have the dental hygienists who have this small percentage of membership, and we're barely able to even afford our one lobbyist. So I hate to say it like that, but that's really kind of what it breaks down to. There's power in numbers. And again, I mean, I hate to think that I think part of the reason that hygienists don't become members is because they don't understand. But then I do think, and this is sad, because I do think that, some hygienists think to themselves, well, they're advocating for me whether I'm a member or I'm not. And that's the tough part, because they're right. I am out there. Beth and I are out there at the State House and the rest of the MDHA board lobbying for the advancement of all dental hygienists in Massachusetts, whether you are a member or not. But guess what? We can't do this alone, and we can't do it with just 600 people. So yes, the number one thing I want anyone to remember from this podcast today is please, please, please sign up and be a member.
Yes, go sign up right now. Just push pause, go sign up, come back, finish up the episode.
We'll be here when you get back.
Yeah, we'll be waiting for you. Okay, so that makes me wonder, what do you think they're feeding dentists in dental school to sell the importance on their association? What are they doing that we're not doing?
That's a really good question. Sometimes, there are some hygienists who say that money is the barrier. Like, they think it's very expensive to be a member. But when you break it down, and I don't know if a lot of people realize this, but you can actually have it set up so that you have quarterly payments taken out. So, I mean, I think I pay like $40 every 3 months. And it just comes out of my checking account. And I don't think about, it just goes, I don't think about, it's not a lot of money. We're hygienists. That's not a lot of money. So there's that. The dentists, of course, they're able to afford something maybe a little bit more, so it's a little easier for them from a financial standpoint. But in school, I don't know. What do you think they say, Beth? I mean, how do they
I
get them
feel
to be
like, and
members?
I know that all schools are different, but I don't feel like my hygiene school put a lot of emphasis on autonomy of my profession, and or joining a membership to keep autonomy of my profession. I think that we need more education in education, right? Because I just don't ever remember thinking it was important until I understood what it did. And that's not something anyone ever explained to me, And I think if I had a mentor in school or a professor that was like, your profession is important, what you're doing is important, and this is how we maintain autonomy and progress professional things in our community of hygienists.
I feel very fortunate. The program that I graduated from was a bachelor program, and we talked about the association quite a bit. I remember a course where we would review bills that were about to be passed or denied, and we would discuss them and talk about them. And many of my educators were actually like on the BOT for the association. So I feel like why we were just like submerged in, this is the culture. This is how you practice as a hygienist here in Utah. But that's not happening everywhere. And I'm wondering, with some of these associate programs, if they're just such a time crunch. They have so many things to cram into their agenda that it's hard to make that time. So I also think the future of hygiene is all bachelor programs. So we all can have more time to really learn everything that we truly need to understand.
Or a master's program, really, because if you look at some of the work that Trisha O'Hare had done, she has a pilot study on the fact that the amount of contact hours and credits that a dental hygienist has, even at an associate level, because it's a 2-year entry to practice, of course, set by the ADA, of course, right, back in 1947, but that's a whole nother, don't get me started on that. But you're right. I mean, it's closer to a master's degree, what we have now. And so you hit the nail on the head, I think, Joffrey, when you said they're cramming so much education into 2 years that, of course, hygienists are going to come out and not feel confident. Of course, hygienists are going to come out and not feel like they own their operatory, or that they have autonomy, and they don't have time to talk about things that are important, like becoming a member of your professional association. So I think, autonomy is probably one of my newest and most passionate fires that have been lit since we attended ADHA this past year. And I think that if we go after autonomy for our profession, that all the other issues that dental hygienists are having will fall into place. I do believe that for sure.
Oh, the future's so bright. There's so many good things that are going to happen and change because of hygienists like yourselves who are putting in those volunteer hours and advocating. So I'm really excited to see changes happen for our profession. But
it's such an exciting time to be a hygienist.
Yes,
it's such an exciting time. At least I think.
Let's see. Gosh, I'm looking at the list of stuff I wanted to talk about, and I feel like we've covered almost all of it. Let's see, Beth, do you feel that there's any, what is the biggest misconception on hygienists doing Botox and dentistry?
I think that just in general, the biggest misconception is that we are just a free dental cleaning. I'm so sick of being stuck in that box of I'm just your free dental cleaning, that you come 6 months a year and I only bleed when you poke me. And I am so ready for this movement of being looked at and viewed as a valid health professional that actually can make a difference, because we do. We make such a difference. And there are just so many studies coming out talking about the mouth and the bacteria in the mouth and how we impact the mouth. And so I think when I look back, I just wish that someone had said to me, you are going to be more than a free dental cleaning. So,
Yeah.
Absolutely. There is a huge misconception in our communities where patients feel that they can treat their hygiene appointment almost like an a la carte. Like, I will have this and
yes.
this, but not the x-rays and exam today. No, thank you. I don't have time for that. And
Yeah.
I'm not really sure how those lines got blurred and how things became so gray, because I know they're not going to their physical appointments doing this a la carte thing. I want this and this and this today, but not the rest.
Yeah.
And
Well, I think
Yeah.
we taught them that. Unfortunately, I think that, you teach people how to treat you. And I think as an industry, sadly, we've taught them that that's okay. And maybe does that trickle down from, hygienists just feeling like they don't have enough time, right? In their appointment. There's never enough time. So if a patient says, I don't want x-rays, and you're already 20 minutes behind, you're going to say, okay, let's move on, but again, if you practice in a way where you have at least autonomy in your operatory, it makes it a lot easier to teach patients how to treat you and how not to treat you. And you're gonna, they understand that nothing's gonna get past you, right, Beth? It's like if Beth says I can't have x-rays and I go to, or I have to have x-rays and I go to Sarah's going to say the same thing.
Yes.
Yeah.
No, once
Right.
again, that's where the team comes in too in our profession, is like, there has to be this standard amongst us as individual professionals that this is our standard of care. This is what we're looking for. And whether you see me or whether you see Sarah or whether you see our other two hygienists, Laura and Danielle, which are phenomenal as well, we are all looking and measuring and watching the same things. We're all going to tell you the same thing because we all have the same goal for you and your health.
Yes, and I love the collaboration that you just described in your clinic. I would encourage all dental practices to have their hygienists sit down and be calibrated to have each other's backs and be on the same page and providing the same level of care no matter whose seat you land in on the schedule that day. It also reminded me of this situation I fell in where the patient needed x-rays. We haven't had x-rays in about 4 years. And those x-rays 4 years ago showed slight bone loss and radiographic calculus. Now, this patient did not want to do x-rays. Well, I said, well, if we don't take the x-rays, I can't clean your teeth today. Like, that's just not happening. And obviously I explained it in much, much more detail for her. She had the audacity to tell me, I was killing the vibe during her hygiene appointment and that she'll just go see another hygienist. And I'm like, okay, I'm comfortable being the vibe killer if that means my patients get superior level of care. Like, I'll be the vibe killer. It's okay.
It's true. It's true.
That's a good one. I haven't heard that one yet. That is a good one. You are killing my vibe.
Yeah, I'm like, okay, that was a new one for me too, but I'm okay being the vibe killer. I'm all right with it.
But see, that's the wonderful thing about collaboration, because if you had sister hygienists that were in your office and the patient said, okay, I don't want to see you, I want to see another hygienist, with full confidence that the next time they see the other hygienist, they're going to say the same thing, because you guys have the same standard of care. You have the same expectations of health. And that makes such a huge difference in your patient culture. Because if I'm doing one thing and Sarah's doing another, then what is the patient thinking? They're thinking either I'm inadequate or Sarah's overbearing, right? Mm-hmm. So, but when it's the same, she's going to hear, you know, she's going to come back and Sarah's going to kill her vibe too, you know?
Yeah,
Yeah.
we're just all killing the same vibe over and over again.
Yeah.
Everybody's vibe is going down.
Mhm.
Oh
But
my
it's
God.
even like, you know, I remember going to like the OBGYN appointments, and there was this expectation that I was going to probably wait an hour before I saw my provider. And I didn't throw like a temper tantrum or anything. I just quietly waited till it was my turn. And it's really interesting to see how patients have become so accustomed to like, my appointment was 5 minutes ago. Why have not called me back yet? And
Yeah.
so I really want to see that kind of change too. Not that I want hygienists to run an hour behind, but I want them to feel like they have the autonomy to run over a few minutes to do a really good job for somebody, rather than stressing, oh, we got to go. Maybe next time. If you're lucky, next time. Right.
Yeah. Yeah. No, I hear you there. I feel like, so last month, I was at the Under One Roof conference, and we were doing the course. It was myself, Dr. Pam Maragliano Muniz, Laura Betancourt, and Danielle Avila from Diamond Dental. We did a course called What's Your Beef? And it was all about the battles between the dentists and the hygienists. And so I surveyed hygienists, and I wanted to know, what's your beef? Like, what are the biggest beefs in dental hygiene with the dentists? And there were four top ones. And the number one was time. It was time. It was time. It was respect. They wanted respect from their patients, respect from the doctors. They also wanted sharp instruments and updated technologies. And the last one, number four, was they wanted autonomy. And like I said earlier, if we just went after that autonomy, I really do believe that all of those other wants and needs will just kind of fall into place. Because do I think an hour is enough time with a patient? Yeah, I do. If a dentist doesn't have to come in and do an exam during my hour
Agreed.
of time, so yeah, I think an hour is enough time for a dental hygienist. But if I need an exam, well, that's a whole nother story. So, I
Agreed.
asked some of my friends who are independent hygienists who own their own practice, and she's like, oh no, every patient, hour and a half. Every patient, hour and a half, which is great, about the thorough care that they're getting. And I just think, yeah, it is the future. I think of hygiene is very bright, because there are so many things that I know that we're working on as a profession. It's sad that the profession of dental hygiene literally is the only profession that is controlled by another profession. So that's what makes things difficult. We first and foremost have to have autonomy over our own profession before we can, make any of these changes that will trickle down into the patients. And then, of course, help to prevent burnout for hygienists. I mean, hygienists are so burnt out because they're trying to stay on time. You're trying to see these patients and, do what the doctor wants you to do. And sometimes, like I had said earlier, it's like, if you're just practicing the way the doctor wants you to practice, I mean, you just kind of feel like a puppet. You don't really feel like a
Yeah.
healthcare provider,
No.
So it's
Then you
important.
do
And
feel like
that's
you're
autonomy.
cleaning.
Yeah. Yeah, no, absolutely. And I just think autonomy is huge. But I do also believe that hygienists need to have autonomy in their operatories before they're able to have autonomy over their profession. Because if we can't even do that, then how are we going to take autonomy over our entire profession? And I always go back to it, Joffrey. I always go back to it. If there's one thing you can do, it's just be a member of your professional association.
I
It's
know
one
when you were describing pricing, it sounded like paying like for Netflix or something, like very out of sight, out of mind. If you set it up for
Yeah,
auto payments.
very easy.
It's
Yeah. And I think they're actually looking, I think ADHA is looking at different like pricing, so for instance, like you said, Netflix, like we're used to paying things on a monthly basis, right? Netflix, cell phone bill,
Yes.
whatever it is, just kind of comes out monthly. So they're even looking at doing monthly payments too for those people who want that. Whatever it is, however it is, let's get you in, let's get you to be a member. There's so many other benefits, outside of even just advocacy. I mean, there's tons of even like tangible benefits, liability insurance and savings on car rentals and like all of those things. But like the best part, if you asked me, is the friendships, and the feeling like, right? And feeling like you're not alone on an island by yourself in an operatory, and you just have all these hygiene friends or hygiene sisters like Bethy.
Yeah.
I love that.
Agreed.
I love listening to how passionate you guys are. You guys, just brighten my whole day getting on this call with you guys. This has been awesome.
Thank you. Yeah, this has been fun. I feel like we kind of went all over the place though, Joffrey. Sorry about that.
This is an organic conversation, and this is what we want. We want the conversation to go. Mm-hmm. This podcast is conversation.
We're multitaskers.
Yes. And I think that's what makes it really fun and engaging for our listeners, that, we are here discussing things in the raw, no filter, just saying what we feel. And so I really appreciate you guys coming on today. We always love popping off with our famous sign-off question. So I'm going to ask Beth first, the first one. Beth, what is something you wish you would have learned in hygiene school that took you years to figure out?
That you'll never get 4 hours again for a hygiene appointment.
R.I.P. to the 4-hour appointment, right?
Oh my God.
All right, Sarah, if you could go back and give yourself a piece of advice as a new graduate, what would it be?
I don't know what advice I would really give myself as a new graduate, but I definitely would go back and tell myself as a new graduate that I'm proud of you and congratulations for accomplishing your goals as becoming a dental hygienist. But I would also say that the best is yet to come.
I agree with that. I would whisper to myself, you're going to make a difference.
That's a good one too. So true. So true. All right. Well, thank you guys so much for joining us today.
This was awesome. Thanks, Joffrey. This